could be a little bit of a mix between some science and maybe some rage, because, and once I introduce our guest, I think you'll see why. So Dr. Elizabeth Jacobs is a Professor Emerita who retired in 2024 from the Department of Epidemiology and Biostatistics at the University of Arizona. Boy, that sounds woke. Her research focus areas during her career included cancer prevention and control, vaccine refusal, and COVID-19. She was the principal investigator of several NIH-funded grants and published more than 120 peer-reviewed papers related to her work. After retirement, she sounds like somebody who would go to our state capitol and testify, and then none of them would listen to her. After retirement, she helped form the public health advocacy group Defend Public Health, a 4,000 member grassroots organization dedicated to promoting and advocating for fact-based public health strategies that will have an impact on the health of every American. She is a primary author of the report that Defend Public Health published as an evidence-based alternative to the MAHA movement. So welcome, Dr. Jacobs. And is there anything that I missed from your resume?
Not at all. Thank you very much for that kind introduction. I did want to say that Defend Public Health is now approaching 10,000 members. So we are continuing to grow apace.
That's fantastic. And I feel like more and more we're going to be relying on people like you to, help make sense out of the senseless. So with that, I'll let you go ahead and make sense for us.
Okay, thank you again. And I'm just going to go ahead and pull up the slides. And hopefully everybody is seeing the slides. Okay, it looks like we are good to go. So thanks for that kind introduction again. And I wanted to say that, yes, I am a Professor Emerita from the University of Arizona. However, I want to make it clear I am not representing them in any capacity for this talk. Who I am representing today is an organization called Defend Public Health. And I have about 30 slides. For those of you who always like to know, like, how long is this going to go on? It's only 30, and the first 5, I'm going to tell you a little bit about this organization. And then I'm going to move on to discuss vaccine exemptions. So Defend Public Health began about a year ago, and Dr. Greg Gonzalez, who is an epidemiologist at Yale, also not representing his university at the time, put out a call to public health professionals over social media and asked, who wants to join an advocacy group? We absolutely knew immediately after the election that the incoming Trump administration was going to be causing a great deal of problems for public health. And although I cannot say we predicted everything that was going to happen, it's actually much worse. We wanted to be ready to advocate for the health of all of us. So immediately, more than 1,000 of us responded, and we had our first meeting in December 2024. And now this group has grown to almost 10,000 members throughout the United States. So our mission is, we are a network of public health researchers, healthcare workers, advocates, and allies who are fighting to protect the health of all from the Trump administration's cruel attacks on proven science-based public health policies. And these come at a rate of about 1 per day of a serious attack coming directed towards public health. Just today, I saw a story that the Department of Education has just decided that the Master of Public Health degree and the DRPH degrees will no longer be considered professional degrees. And that is, frankly, an outrage. And the long story short is it's going to reduce the amount of funding that we have available to train and support our students, if that stands. There are a lot of national groups that are pushing back really hard on that. My understanding is that also nursing degrees, they are deciding are not professional degrees. So this is the climate in which we find ourselves. So our organization believes that everyone has the right to everything they need for a healthy life, regardless of race, ethnicity, religion, disability, sexual orientation, gender, or gender identity. And I say these words on behalf of every single person who works in public health, many of whom are no longer allowed to make statements like this. So since our inception, Defend Public Health members have appeared or written articles for many of these major media outlets, hundreds of them at this point. And I want to point out more importantly, we have also had pieces in the Arizona Daily Star and the Arizona Capital Times. The reason that is critical is Defend Public Health is really starting to focus on state-based advocacy because public health powers largely reside within the state. And so we really want people to be aware of what's happening in their state and take action to protect public health policy in the state. So my colleague Jim Allwine and I have basically formed a writing team, and we're writing a lot of op-eds regularly about attacks on public health. And so we are grateful to the Daily Star and the Capital Times for helping us get the word out. So like I mentioned, this organization has been all volunteer since the start, but we did just get a grant, I'm very excited to say, so that we can start building out our state-based advocacy efforts. We are actually currently hiring an operations manager and 2 organizing managers, and we're very excited about that. But none of the coordinating committee, which is the original group that writes the policies and oversees Defend Public Health's activity, will receive any funding from this grant. None of us get paid, and none of us will get paid. And I think that's a very important distinction because already some little chirps have been coming from the right-wing media, accusing us of not really being a grassroots group, trying to tie us to Soros and all that. And the fact of the matter is we do not have conflicts of interest because we do not have funding. So now I just wanted to start talking a little bit about vaccine exemptions. And again, as Defend Public Health is working to build state-based advocacy groups, one of the reasons is that vaccination policy is largely done at the state level. So before I get into the specifics of vaccine exemptions, I just wanted to do a little walk through vaccination history. It kind of has an exact growth pattern as the anti-vaccination movement itself. So in order to fully understand what's happening with the anti-vaccination movement, we need to understand a little bit about the history of vaccination. So way back in the 1700s, there was a procedure called variolation, and that was the first form of immunization that we had in the United States, and it was used against smallpox. Cotton Mather is often given the credit for introducing variolation to the US or to the colonies, but more recent scholarship has indicated that actually it was an enslaved person, a man named Onesimus, who told Cotton Mather about this in the first place. So I'm sure this comes as no surprise to anyone here, but now the latest scholarship indicates that both the African continent and China were using variolation well before it came to our shores. So in the colonies, I guess, the widespread use of this procedure began in the 1700s. And basically the process was this. In order to do this procedure, you needed to find somebody with an active smallpox infection. And I did not put a photo here because it is an uncomfortable disease when you see the physical manifestation of it. But what the person would do is scrape some of the pustules, the blisters, off of a person with an active smallpox infection. And then they would go to the person who's undergoing the procedure and make an incision in their arm and then stuff all of those pus blisters into it. And in that way, you created, hopefully, a well-controlled and mild smallpox infection that would protect you from getting a raging smallpox infection later on. So I can understand, I'm sure all of you can understand why some people immediately objected to this procedure. It is not sanitary, even though we didn't know about germ theory at the time. People would get other, infections from it. And it really is a window into history to tell you how terrified people were of smallpox to put their children through this procedure, which admittedly was not great. And so with variolation came an anti-variolation movement, and that is the precursor to what we have today. So Ben Franklin summed up a little bit of what I mentioned very well with this quote. He said, "In 1736, I lost one of my sons, a fine boy of 4 years old, by the smallpox taken in the common way." And in that sense, he means that his son contracted smallpox just naturally from somebody who had it near him. He goes on to say, "I long regretted bitterly and still regret that I had not given it to him by inoculation. This I mention for the sake of parents who omit that operation on the supposition that they should never forgive themselves if a child died under it. My example showing that the regret may be the same either way, and that, therefore, the safer should be chosen." So in that, he is saying that parents should get their kids to undergo variolation, no matter how dangerous it may seem, because that is how much of a threat smallpox actually is. And I try not to tear up sometimes when I read this, because parents are all the same, throughout the years, and imagining losing your child to that and the guilt that he clearly felt is really hard. So along those lines, the anti-vaccination movement hasn't really changed much since the 1800s, for example. So you'd see people pushing back, and there are four main messages that they use, and they have used since even earlier than 1895. And those are in the left column here. So these are direct quotes from a lawyer and quack named Montague Leverson, and this was in 1895. And in the right column, these are quotes from a lawyer and a quack named Robert F. Kennedy in 2025. So one of the messaging attacks they use is to accuse expert vaccine advisory committees of pro-vaccine bias. The quote from 1895 is, "That commission was deliberately packed at its very outset." Robert F. Kennedy in 2025 said, "The committee," and here he's referring to ACIP, which I'll talk about in a minute, "has been plagued with persistent conflicts of interest and has become little more than a rubber stamp for any vaccine," which is a wholly false accusation. They also falsely say that vaccines themselves cause death. In 1895, Leverson says vaccination has caused more deaths and diseases than ever has smallpox. Completely false. And Kennedy said the COVID-19 vaccine is the deadliest vaccine ever made. So you can see the rest of these quotes here. I won't go through and read them. I will only say that two other messages they like to do is say that healthcare practitioners and scientists are only supporting vaccines because of the money, and that they use false and inflammatory words to attack vaccines in the public, and it plants the idea in the public's head that vaccines are bad, such as saying there's blood poisoning or calling vaccines toxic. And these are regular tactics that they use. I did want to add too about when they claim that healthcare practitioners and scientists are only in it for the money. I myself have been accused many times of being a pharma shill. And so I will just say that I would really like to know where the big pharma money pot is, because I have never gotten paid by any company, and particularly not by any pharma company. I simply understand that vaccines save us from a lot of illness, death, hospitalization. So another piece that hasn't really changed much about the anti-vaccination strategy is they used to use leafleting. So groups like the Anti-Vaccination League in the 1800s would just wait and see birth announcements in the newspaper, and then they would track those people down and take leaflets to their house and leave it on their door, where they would make really false statements about vaccination. And a doctor wrote about that anti-vaccinators had, quote, been discouraged by the result of their legitimate endeavors to oppose mandatory vaccination laws, and they are now having recourse to circulars, which depend for their influence on vague threats and unwholesome insinuations. This is exactly the same as what's happening now, except our leafleting strategy can now reach almost every person on the globe with the blink of an eye, in the blink of an eye. So we have social media, we have just regular web pages like the National Vaccine Information Center, which sounds and looks legitimate, but their sole purpose is to undermine vaccines and spread disinformation. Twitter, now X, was a big purveyor of vaccine disinformation. And then even the legacy media, this was an article about the HPV vaccine, which was published by the Toronto Star, casting doubts on HPV vaccine. This piece was later retracted because so many scientists and healthcare providers wrote to them and said, this is actually so false and so inflammatory that you cannot maintain your credibility if you leave this article up. It was filled with just lie upon lie about alleged side effects of the Gardasil or HPV vaccine. And then, of course, the Lancet. So peer-reviewed medical and scientific journals are not immune to this. The Lancet famously published Andrew Wakefield's paper, and that this is what kicked off the whole MMR, it causes autism spectrum disorder lie. And it took years and years and years, but through the work of a journalist named Brian Deere in particular, this paper was ultimately retracted as well. So this is the modern day leafleting, and it has a lot more reach than the people of the 1800s could ever dream of. So there are many parallels to today. They have really no new material. One of the things they love to do is assign causality to a temporal relationship. So they'll say, well, you know, my kid got the flu after they got the flu vaccine, but that is not the question. The question is the proportion of people who got the flu after they received the vaccine the same as the proportion of people who got the flu who did not have the vaccine? And that comparison always shows that vaccines are safe and effective. But it's, as humans, we do like to identify patterns. We like things to be nice and neat. And epidemiology is often not nice and neat. And so to explain that you absolutely have to have a denominator to compare any, make any statements about what a cause would be, that it's kind of hard to explain that, particularly when we're confining ourselves to 180 characters per post or similar. So what's different today is, of course, social media. It's an absolute vector of misinformation and disinformation. And of course, this group knows more than anyone, it is not confined to vaccines or to public health. It has infected every area of our lives, and it is out of control. And furthermore, social media companies have no motivation whatsoever to stop it. The reason is that misinformation has been shown to spread hundreds of times faster than a boring factual statement like vaccines are safe and effective. And that creates engagement, and engagement is what makes these companies money. So it is very difficult to go in and ask a social media company to start to up their efforts to ban misinformation. So the net effect of all of this, you know, stuff floating around and coming together is that we are in the United States currently experiencing the greatest increase in the number of vaccine exemptions that we have had in our history. So I want to talk a little bit about exactly what vaccine exemptions are, what types there are, and what procedures there are to get one. In short, a vaccine exemption is when parents opt out of vaccinations that are required for enrollment into school or daycare. Every state in the US has at least one kind of exemption, and you can see the main categories here: medical, religious, personal belief. So I'll start with medical. This one I absolutely support. A medical exemption is when a child may be going through chemotherapy or have another condition in which the risk benefit ratio for them of a vaccine is not favorable. And so there's really a tiny fraction of kids that this would apply to, but I do believe every state should have a medical exemption. The next type is religious, and 29 states have religious exemptions. The people on this call know far better than I do about the numerous issues with having religious exemptions and the position that it puts the state in. But, you know, just from my superficial knowledge and experience, I can say that it's really difficult for a person in a health department, for example, to say, your religion, your religious doctrine does not at all support you not getting vaccinated. It's putting, you know, the separation of church and state. It's really difficult to put people in that position to say, we don't actually think this is a valid religious belief. Now, I say that, but the major world religions, none of them are opposed to vaccination. And in fact, both the Catholic Church and Jewish faith leaders have come forward and said that vaccination is the way to help support the health of our communities and the people in them. So not only do most religions not oppose vaccination, but the big ones definitely promote vaccination. To my knowledge, the only two religious groups that really have this as doctrine would be Jehovah's Witnesses and maybe Seventh-day Adventists. Very small fraction of the population would fall into those categories. You hear a lot from people like RFK Jr. about how the Amish and Mennonites don't vaccinate, it's against their religion. That is nonsense, complete nonsense. Some groups of Amish and Mennonites do vaccinate, and if anything, it is not a religious doctrine. It's more of a behavior that a group of people adopts for any number of reasons, but it is not part of their religious doctrine at all. The last type of a vaccine exemption is the most insidious kind. It is the personal belief or philosophical exemption. And that is when you just say, my kid's not getting vaccinated. I don't want him to. That's it. That's all you need to do. So this is a really big problem. And I'm going to talk a little bit about this in the context of Arizona in a second. There are now 5 states in the US who do not allow any type of exemption except for medical exemption. And in this map, you can see this hopefully, that the light green color allows for religious and personal belief or philosophical exemptions. You can see here's Arizona. We are one of those states. The yellow ones will allow a personal belief exemption, which would basically include religious exemptions. And then the darker green states only allow religious exemptions. The orange states are the ones that do not permit, or until recently did not permit, any type of exemption except for non-medical. And those are Maine, New York, Connecticut, West Virginia, and California. And remember that, because that's going to come back in about 3 slides. So I've talked about the types of exemptions, but now I want to talk about how you get an exemption. There is now a procedure as well. You have these categories, but how do you actually get them? The protocols, as I said, are set by the states, and they vary widely. So some states, you just need to sign a pre-printed form, and that's it. And you turn it in at the school, and the school will submit it to the health department. Other states have an entire really in-depth process for doing that. And you have the parental signature, it has to be notarized, then you have to go to the health department in person, and then the health department has to approve it. And that's a pretty onerous procedure for obtaining an exemption. I think, you know, when you get down to it, it should be harder to get an exemption than it is to get a vaccine, because otherwise you encourage people who may just not even have a chance to go get one to just say, oh, I'm not going to do it. So I actually do agree that it's hard. It's better to have a more difficult exemption. And I'm going to show you why I think that in a minute. But the current Arizona exemption protocol is in fact one of the earliest or the easiest in the United States. We have a form that I'm going to show you that is completed by a parent at enrollment of kindergarten, 5th, and 9th grade. And this form is very easy to get. It's online. The school nurse can give it out. You just need a parent to sign, and you can exempt on all or select vaccines. So this is what our exemption form looks like. And I wanted to highlight something that because of the work that we did, sorry, it's not loading. I actually screenshot that when apparently my computer was doing something. But anyway, some of the work I did with my colleague, Dr. Casey Ernst, on vaccine exemptions in partnership with ADHS, which at the time was led by Will Humble, we worked on some research and came to the recommendation that ADHS should not just allow parents to sign a form saying, I am going to exempt my child. What we had added to the form was these boxes down here, where a parent has to acknowledge that they understand the risks of exempting their child. And then they also have to be note that they're aware that if there is an infectious disease outbreak, their child may have to be excluded from school until the outbreak is over. And the local public health authorities have the ability to do that, to actually ask kids to stay home from school, not ask, order kids to stay home from school if they're not vaccinated. And the last time I remember that happening was in Tucson. I want to say like a decade ago, where Dr. Francisco Garcia was in charge of Pima County Health Department at the time, and he ordered some kids to stay home. I believe it was the Vale School District. There was, I want to say, a pertussis outbreak at the time. So public health does have these powers, and I think we need to flex them a lot more. So I've shown you how easy it is to get an exemption in Arizona, and I've shown you how hard it is to get it in other states. So these are the most recent data that have been published by the CDC. And I want to add that I often get asked, is our CDC data still valid? I want to say that the CDC still has literally thousands of legitimate, qualified, hardworking scientists there. What you're seeing that causes all of us to doubt the CDC is the leadership and the messaging that's coming out. It has absolutely been taken over by political appointees at the top levels. So it's a hard line to cross, and I do say that people should probably consider looking at the World Health Organization right now. However, the CDC is still publishing some solid data, and these data are some of those. So you can see that those states with the most exemptions, the highest percentage, I should say, are Idaho, Utah, Oregon, Alaska, and there we are at number 5, Arizona, a very dubious accomplishment. Idaho's form even just dispenses with what I showed you about acknowledging the potential risks of exemption. You just sign a form and turn it in, and it's resulted in 15.4% of kindergartners coming in without vaccines is just treachery. The states with the least proportion of exemptions, you can see California, New York, Connecticut, Maine, and Mississippi. And I mentioned when I showed you the map to remember these states. These are the states that do not allow any kind of exemption except a medical exemption. So the take-home message here is exemptions are absolutely related to vaccine coverage in the United States. There's just no doubt about it. And I wanted to give you a note about Mississippi. Until 23 or 24, Mississippi was one of only 2 states that would not allow any exemptions, along with West Virginia, except for medical exemptions. And what happened was a couple years ago, Mississippi decided to change that, and now they allow exemptions. So this may be the last time you see Mississippi in the bottom 5, because their exemptions are already ticking up. West Virginia, being the other one, is currently in a battle over this very thing. And I'm not sure what the status is right now. I couldn't keep up with it, but I know there's been a battle going on there about allowing exemptions. which is truly tragic. And then for those of you who like a figure, this is showing the proportion of exemptions over time in the state of Arizona. This is from when I started doing this research way back in 2012. And then this is up through the current year. You can see this really dramatic spike of exemptions going up after the pandemic. And I really, again, strongly object to the assertion that's put out by RFK and Bhattacharya and Marty Makary of the FDA, claiming that, you know, this distrust in science that somehow rose organically. The distrust in science has been fostered, nurtured, and farmed by people like RFK, Bhattacharya, and Makary, who sat there and tried to undermine every single thing that public health did when we were in the midst of a pandemic of an airborne pathogen. And they have now been lifted to the highest levels of public health in this country. So this is from a paper that Dr. Casey Ernst and I published back in 2012. And this is why, again, another illustration that if an exemption protocol is easy, it's going to affect your vaccine coverage in the state. So what we did was we reviewed every single state's procedure for obtaining a vaccine exemption, and we categorized them as easy, medium, and difficult. And so this doesn't add up to 50 states, obviously, because we were looking at philosophical exemptions only. But you can see that the more difficult it is to get an exemption, the higher the vaccine coverage is. So even if these exemptions exist, if you make the procedure difficult, then it actually results in a higher level of vaccine coverage. So vaccine exemptions are not trivial, and these are not situations that only affect the individual. They affect all of us. So there is, of course, case law from Jacobson versus Massachusetts in the early 1900s that simply states that the rights of an individual to exercise their religious beliefs does not supersede the right of the community of everybody else to be protected from diseases. And that case law still stands to this day. So when people say, well, this is just a personal choice, this is medical freedom, why do people get medical freedom to not vaccinate, but the rest of us don't get medical freedom to not be infected by an infectious disease that could be preventable? So that's a question that constantly needs to be brought up. So I've walked you through the type of exemptions, the impact of exemptions on vaccination coverage, but what about what we all really care about, the development or the prevalence of or incidence of infectious disease? And so this is a classic paper from the year 2000 by Feiken et al. And JAMA, and it really shows a striking contrast between the incidence per 100,000 among kids who are exempt from vaccines and those who are vaccinated. And the long story short is, on average, exemptors were 22 times more likely to contract measles and 6 times more likely to contract whooping cough than vaccinated children. So again, we can clearly see that this is not a personal choice per se. This is an issue that affects your community, because when you're in the midst of an outbreak, you're using public health resources. And there was a paper a few years ago that showed that the cost of containing a measles outbreak in Pima County, and this was around this period of 2009, 2010, cost about $700,000 to contain. So again, it's not just health, it's also has major impacts on financial aspects, and not just of the community, also on the individual. We know that a hospital stay can bankrupt you right now. So this is one of the reasons that we really want to keep kids out of the hospital. So this is another figure from the research that we did years and years ago. And I want to put this up here because what this is showing in these dark red, menacing looking places are where vaccine exemptions are the highest in Arizona. These are where they're the lowest, and the hatch marks are usually tribal areas where we don't actually have data. But I wanted to bring this up because you can see right here in this angry red spot is exactly where the measles outbreak in Arizona is occurring right now. So it is absolutely maddening as an epidemiologist to know that we can predict with a very high fidelity which areas are going to experience an outbreak, even 13 years in advance. And, you know, the powers that be just don't seem to care. I also wanted to add some of the work we did around the same time where we looked at what are the characteristics that lead people to exempt kids from vaccines. And I also want to take this a second to point out that vaccine exemptions are a whole different problem from vaccine access, which is usually a challenge for people who don't have as many resources, that they may not have the ability to go to a doctor and get these vaccines. But that is why the Vaccines for Children program works so well. It is designed to provide vaccines for under-resourced families, and it's been very effective. But this is the different situation. This is for people who actively choose not to vaccinate. So who are they? We looked at schools with high rates of exemptions versus low, and you can see that over here, basically the schools with the highest percentage of white students had significantly higher rates of exemptions. We also observed that charter schools have a massive number of kids who are exempted. That is a major risk factor for a lot of exemptions. And then finally, as the proportion of free and reduced lunches goes up that's offered at a school, the number of exemptions go down. So all this taken together provides sort of a profile of a white middle to upper class families are the ones that choose not to vaccinate their children. And they're often very educated. But that again was from 2012, and things were staying pretty much like that. There were many papers that showed the same thing, that this was a phenomenon that was in the white middle to upper class. But what we've seen since the pandemic is that the latest data are indicating that those who report Republican Party affiliation are more likely to refuse vaccines than other groups. We know that areas with high Republican voting registration are less likely to be vaccinated. And when I started this work, I would say that the extreme left wing and the extreme right wing were both about equally likely to refuse vaccinations, but now it has shifted to the right. It isn't, there's no question about it. The data are coming in. Again, misinformation and disinformation on social media is fueling the inferno. It's becoming part of this package of Maha MAGA that's sort of morphing together into a whole array of terrible ideas about public health. Another major problem is that disinformation is now coming directly from the White House and from Health and Human Services because of RFK Jr. So we have now put in a leadership position a man who actually doesn't even believe in germ theory, as he wrote in his book. So it's really not too much of a surprise that things are going downhill really quickly. I do sometimes just have to stop and think about the level of disinformation that is coming from the United States government is absolutely shocking. This is the type of thing that we would have read about in maybe the Soviet Union or something, you know, many years ago and felt pretty smug because this couldn't happen in the US. It's happening. I mean, there's, you know, this isn't hyperbole. What else is RFK Jr. up to with regard to vaccinations? He's personally responsible for a massive amount of vaccine misinformation that has been shown to come from his social media accounts. And there was a report written about this, actually, I want to say like 5 years ago now. He's one of the most prolific spreaders of disinformation in the world. Excuse me one second. Okay. So as many of you know, he also fired the members of the Advisory Committee for Immunization Practices. And he replaced them with these people, and by my own estimation, about 80% of them would not have ever been considered to be qualified to serve on this committee by any other administration. And why is this such a big problem? Well, this is the committee that not only decides who is recommended to get certain vaccinations, but they also decide what insurance must cover under the Affordable Care Act. So if they recommend something, it has to be covered. And if they don't, it doesn't have to be covered. They also decide on what the Vaccines for Children program will cover. And so this is a dangerous situation where we have a number of staunch anti-vaxxers on this committee now, very dangerous. And I watch their meetings religiously and post about them, but honestly, I like have to take a nap after that. It's just so infuriating to watch non-scientists, make unsubstantiated claims, and even scientists make unsubstantiated claims. They've reached out to the fringes and pulled in the worst of the worst. So, and then again, he's placed a completely unqualified political appointee at the head of the CDC. You may have seen, Susan Menarez beautifully testifying in front of the Senate Health Committee about the absolute treachery that RFK Jr. was up to when she was the CDC director for all of 1 month before she refused to follow his orders and he fired her. So the guy in place now, Jim O'Neill, no training in medicine, no training in science, no training in public health. And he is in charge of the Centers for Disease Control and Prevention. This is the situation in which we are now living. Now this, I'm sorry, I have to walk you through this. I hope I don't bore you to death, but this slide is probably the most dangerous attempt that Kennedy is now embarking on. So I want to talk a little bit about the Vaccine Injury Compensation Program. So you may have heard that in the US, you cannot sue a vaccine manufacturer. And for the most part, that is correct. But let me tell you why. So way back in the day, I want to say that the mid 80s or so, you all know we live in a very litigious country. And what was happening was that because pretty much every child in the US gets vaccinated, there were a ton of spurious lawsuits that were being filed against vaccine manufacturers for conditions that had nothing to do with the vaccine. So even fighting those lawsuits by these companies was just costing them a tremendous amount of money. And contrary to what you may have heard, vaccine manufacturers do not make a killing off of vaccines. So when they had to spend so much money and resources on fighting spurious lawsuits, they started saying, we're not going to make vaccines anymore. This is like way too much hassle. It's actually costing us money. We're not going to do it anymore. And so the US government saw that correctly as a very serious threat to public health and to national security, because that would have required us to get vaccines from other countries. And so in order to maintain the standards and the safety and the quality control that Americans generally expect, the government set up the Vaccine Injury Compensation Program. And through this mechanism, if you believe that you were harmed by a vaccine, you can take your case to the VICP and you can receive compensation. Now, I want to be very clear about two things. One, the VICP is funded by an excise tax on every single vaccine that is sold by these companies. Two, the bar to get compensation through VICP is significantly lower than if you were to go to court. So you are much more likely to receive compensation through this program than if you sued a vaccine manufacturer. So that's why we have VICP. Now, what you keep hearing little murmurs of is that Kennedy wants to make some changes to this program. What he wants to do is add conditions that truly there is no evidence for vaccines causing. to the list that you can take and ask for compensation for, including autism spectrum disorder. And what will happen if that comes to fruition is that the VICP is going to get bogged down to the point that it is no longer functional, because there's going to be thousands and thousands and thousands of spurious lawsuits filed. And what that will do is that will end VICP very effectively. In turn, it will allow people to again sue vaccine companies, and they will stop making vaccines in the United States. All of this, of course, benefits Kennedy, who has made an incredible amount of money through his firm suing vaccine manufacturers. Remember, hopefully, we only have 3 years left before he is no longer in the government. Well, hopefully it's shorter, but he is setting it up so nicely to be able to sue vaccine companies and make money. If you ask people what his motivations are, you'll get a lot of different answers. I believe that one of his motivations for this insanity is that he is setting it up so that his law practice is making tons of money for all eternity. So thank you for going on that journey with me. But that is something that people like Dr. Paul Offit have been talking about, as something they're very concerned about happening. And obviously Dr. Offit is a far more well-known person in public health than I am. So don't listen to me, listen to him, I guess. So vaccines, of course, are not the only target of the current regime. Before I end this presentation, I just wanted to mention, of course, they're undermining research funding. They want to lower indirect cost rates. They are targeting universities. I'm sure everybody here was aware of the compact that was sent to the University of Arizona, and I think it might be at ASU now, where basically I shouldn't say we, I'm no longer there, but the university is basically asked to sign this document in order to get enhanced federal funding. But that's the carrot. The stick was that you would have hanging over your head constantly the threat of having to pay back all that federal funding if the Trump administration decided that somebody did anything they didn't like. That's literally what the language was. They could just yank your funding and bankrupt you. So for now, at least the U of A has declined. EPA protections are being peeled back. Public health infrastructure is being destroyed. And I am not, this is not hyperbole. They are destroying public health from the ground up. And of course, as I mentioned, anti-public health disinformation is regularly disseminated from the US government. I know you're all familiar with the Tylenol debacle and, you know, Trump telling us all not to use Tylenol. And then Trump telling us that the MMR should be separated into 3 separate vaccines. Absolutely ludicrous. And frankly, it's intolerable. So overall, vaccination exemptions are rising at unprecedented rates. Our culture is changing. We have got to work on being responsive to this, including we have to get some sort of regulations on social media to stop this perpetuation of disinformation. At the state level, it's really important that we pay attention to what our state legislators are doing and stop them from ruining the vaccine requirements for school entry, as Florida has announced that they are doing. Thankfully for us, Katie Hobbs has already vetoed 2 anti-vaccine pieces of legislation that would have undermined vaccine requirements. But you know, that could change at any moment if somebody else gets into office. And in summary, yes, public health is under attack from just about every angle. So that is the end of this. And oh my gosh, I went way longer than I thought. So yeah, I just wanted to put up our social media handles. You can reach me here and I'd love to hear from you. So with that, I'm so sorry I ran late. I'm happy to take questions.
Don't worry about it at all. That was very thorough. And as I said, yeah, it's definitely a pretty fair mix between rage and science. So thank you for the science. And hopefully it'll, motivate some of us to especially support your organization. And thank you for filling in the void that is being left at a very alarming rate right now. Let me go back in the chat real quick. People are basically saying that they're already seeing changes. I know that, and changes of obtaining their medical care, right? Their health care. They're already seeing changes on questions that are being asked on forms, that questions were never asked before. But like now also the fact that I'm looking at my healthcare bill and it's going
Oh,
up, and everybody I know's healthcare insurance premiums are going up, and so there was a question in here. I can't quite find it now. But Matt basically, he's like, what is the point? People are going to like, what, why, when it's so clearly proven that vaccines keep people safe, why would any, like any country's leadership decide that this is going to be some kind of policy?
yeah, I do get that question a lot. And I think a lot of it has to do with, from RFK Jr.'s standpoint, that he profits from it. And I don't think that can be understated. Now, overall, this is to me just part of a giant effort to undermine every institutional government and institution that we have. We're seeing it everywhere, and people bring this up. I live in the public health world, so that's what I'm most familiar with. But you can see this in the Department of Education and everywhere else. They're just simply trying to destroy everything because they don't believe the US government should be doing things like ensuring that public health is functional.
Yeah, and I mean, it is about the money,
Yeah.
like look at all of the podcasters who are peddling ivermectin and supplements and like UV ray therapies, like whatever it is. Wendy Rogers is constantly like talking about hyperbaric chambers, and I mean, I don't even like all the things. And it's really alarming. I have a 19-month-old grandson, and I
Oh,
worry constant. Thankfully, his parents are woke.
yeah.
But like, when I mean woke, I mean like they believe in
Yeah, yeah,
science
yeah.
and
Yeah,
reality.
that's
Yeah,
woke
that kind of
now.
stuff.
That is
Yeah.
woke now. Yeah.
I just, in
Um,
case somebody tries to clip that later on, I figure I might as well try to,
yeah.
yeah.
Well, I mean, you bring up a great point. These folks are selling, they're either selling stuff or suing someone. That is their goal. And so for the snake oil people, I have seen a ton of ads just explode for all of this nonsense. And I usually screen shoot them because I'm like, oh, what is this? So yeah, there's profit involved. They first have to convince you that modern medicine doesn't know what they're doing, and then they can sell you the magical cure. And Paul Offit wrote a really good book about this called "Do You Believe in Magic?" I highly recommend it. But yeah, that is a big driver for all of this.
So is there, when we encounter this kind of stuff, maybe in our just regular lives, maybe some of us still go back to our families for the holidays. I haven't in quite a while now, but if you do, like, how do we have conversations? Is there a way to have conversations? I mean, we've talked about strategies before about various different topics, but is there any way that you see that maybe gets through to people?
Well, that's a great question, and it really depends on where their head is. I do want to be clear that an anti-vaxxer is not the same as a person who legitimately has concerns about vaccines. Ask the questions, but the key piece that you can differentiate them almost instantly is when you give them an answer, do they listen? Do they accept it? And maybe ask a follow-up question, but don't immediately come back and tell you you're wrong or what about la 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 la. So once you differentiate that, somebody who has genuine concerns, you can actually show them studies, you can take them to the CDC website or other that may be more user friendly, and you can have a really good conversation. As for somebody who is completely in the anti-vax whirlpool, in my experience, they're not leaving. They're not leaving.
Mhm.
And that is why I feel so strongly about maintaining our vaccine requirements for school entry using the law,
Mhm.
because once they're lost to us, they're lost to us.
I feel like a big reason that I've heard people give throughout my life is, especially when children are younger and they get really worried about like the busy vaccine schedule. It's too much too soon, and their little bodies are. I mean, because I had to watch my grandson after a shot one day, and it was not pleasant. I'll tell you that much.
Oh, sure.
But it was
Yeah.
better than him like dying of whooping cough. You know what I mean? So like,
Yeah.
what would you tell those parents who maybe are concerned, and especially now when they could be out and about with people who are just like, yeah, I don't care, my kids aren't vaccinated.
Well, the risk of the disease is significantly more substantial. And again, it's sometimes hard to illustrate that for people, even if they're not like totally against vaccines. Like nobody enjoys getting their child vaccinated, and no child really enjoys it either. But one of the things that I learned from a marketing group at Eller College at the University of Arizona was that you can use something called regret anticipation to try to convince people. And what that would be is showing them that Ben Franklin quote and saying, how do you think you would feel if your daughter at the age of 30 came to you and said that she had cervical cancer because you chose not to get her vaccinated against HPV? And to think about things like that.
Yeah, it's like there's the Roald Dahl quote that comes
Yeah,
out whenever there's a measles outbreak. It's really heartbreaking, and yeah, that's a great suggestion. Well, this was both depressing and informative, but also for me right now, it also is inspiring because the more I do hear about this kind of stuff, the more I can't help but be motivated to do something about it. So with you and watching as these institutions are kind of being decimated from the inside out, what gives you hope these days?
what gives me hope is that Defend Public Health has so many members who are working, who are aware. We're not alone in our concern about this. It's not like a fringe or hysterical concern. It is a real concern. And so being surrounded by people who continue to work and fight for the scientific principles and evidence that we know exists, that's what keeps me going. That's where there's hope. The Trump era is going to end one way or another. And when that happens, we will be able to rebuild and build better, actually. And we're actually already moving into that sphere where there are groups getting together to talk about what public health is going to look like in the future. And I'm really honored to be part of those groups. So, we are working and working on protecting our future. So that gives me hope.
I love that, like because while we may be looking around and seeing a whole bunch of destruction of like institutions and institutional knowledge, what does that give us opportunities for? We get to
Right.
build it back however we want it. And this time, maybe we will include the healthcare needs of women and people of color and our most vulnerable citizens. Like, how great is that for all of us to be on the ground floor to build something like that back up?
Absolutely. And the public health system wasn't perfect by any means. There are things that could be changed, and we have an opportunity to do that now. It's unfortunate that we have to suffer so greatly first, but maybe what comes in the future will be even better.
Heck yeah, that is what I'm hoping for. Like I said, I've got a grandson, so we're all gonna have to work really hard to make things better for the next generations. And we might not even see it, but what a great reward for us to be able to build something cool. So
Yes.
well, thank you so much again, Dr. Jacobs, for joining us. I appreciate you so much.
Anytime.
Yeah,
Yeah.
and thanks to
Thank you.
everybody else. Yeah, thank you so much, everybody, and have a great weekend. We'll see
All
y'all
right.
next week.